Hi, this is Ann, and another episode of Beyond Addiction podcast from Gulf Breeze Recovery. And today we're speaking with Renee, a therapist at GBR. Hi, Renee.
Hi.
Now, would you mind telling everybody who you are and what it is you do at GBR?
Sure, sure. I am a therapist here at Go Breeze Recovery, and I mainly work with clients in individual sessions. I have led some of the classes and the groups, some of the recreational groups, but I mainly focus on working with clients in individual sessions.
Okay, well, that sounds great. Can you let us know how it is that, what your background is, a little bit about what you've done in your past, and then how you found Gulf Breeze Recovery? How did you land there?
Sure. So this is actually my second career. I was the vice president of a marketing firm for 22 years, and where we worked with a lot of behavioral health clients, and really kind of working with consumers and demographics, anti-smoking initiatives, opioid awareness, and that type of thing. And went to grad school, changed my career during COVID, knew I always wanted to be a mental health therapist. And when I was looking for internship opportunities, I really wanted to work somewhere that was mindfulness based and took a very integrative approach. And that's how I came across GBR.
Wow, good for you. Because there aren't that many recovery centers that are mindfulness based, correct?
No, honestly, I am not really familiar with any other ones, especially in this area or in the state of Florida.
Yeah. Now, I wanted to know because all of us have been touched by somebody having some kind of a problem. And I was wondering if you personally had a family or an experience with addiction in your life with a family member or someone else that you're familiar with.
I have not. So I do not personally have anyone in my family that struggles with addiction. But I do have a lot of experience working with trauma. And so as we know, it's very hand in hand and very comorbid. So that was more of my interest in coming in this type of facility. And I was very interested in working in recovery.
Yeah, I mean, you touched on it. It appears that so often there's a trauma experience, and then the use of some substance is just an innocent attempt to handle it. And it usually works for a while, right? And then
Right.
what? And then what happens?
Right. And then things really start to crash all around because really you're just dealing with the symptom and not the cause.
Yeah, yeah. And how would you describe the approach at Gulf Breeze Recovery to trauma and substance abuse to be different than other places that you're familiar with or know about?
Right. Well, it's very holistic, which I have found to be very therapeutic. Not only does it incorporate talk therapy in individual sessions and group sessions, but we also offer neurofeedback. And a lot of the therapists here are EMDR certified, as I am. So that is also a big offering that not a lot of places have. It really helps, I would say, blending the trauma and the addiction piece because so many people hold on to trauma for so long and don't even realize that they have trauma. Most people think of trauma as having to be some big, massive disaster or terrible experience versus all the little T's or the little traumas that happen throughout life that just start to build and build and build and live within our bodies.
Yeah, because people talk about so often I talk to guests at Gulf Breeze and they talk about having an insight. And some of it is like, oh my gosh, that was trauma. And I just dealt with it. I never really gave it a name. And
Right.
now that I have a name, you mentioned EMDR, and I don't want you to have to clinically explain what it is, but give the listeners some idea of how EMDR works and how it's used with trauma people.
Sure. So I like to explain it as traumas that live in our brain. So on one side of our brain, like all these traumas are here, all these maladaptive ways of coping. It could be avoidance, it could be using substances, it could be a myriad of things they're unhealthy ways to try to combat these sorts of feelings and thoughts associated with traumas. And so this little wall, invisible wall, gets built up in our brains to where our coping skills are hanging out on this side. And they really want to get over there and they really want to help. They want to help us with emotional regulation. They want to help us work through these traumas, but they can't get there because of this trauma wall. And so with EMDR activates the neural networks. It activates the maladaptive neural networks and it activates the positive neural networks to where these positive neural pathways are like, oh, wait, hey, I can get over there and I can actually help. I can help you work through this. You don't have to relive it, but it's allowing it to be processed through so that you can finally release that layer. I also look at it as like an onion layer. So that way that trauma wall slowly gets chipped away and the bridge comes over from our adaptive networks so that we can actually feel more like a normal person trying to live life instead of having to carry the weight of traumas.
Wow, that was great. I've never had it explained so well for a person like myself who didn't really know very much about it. It makes a lot of
Mhm.
sense because there's fear for someone. Not only you're going through the process of selecting, but then when you have to make a decision, and like let's say you decide, okay, this looks good. Maybe I should talk about it, but I don't want to do detox.
Mhm.
I'm afraid of detox. And what I've heard about detox in Gulf Freeze recovery is that such wonderful care has been taken.
Mhm.
Some people say what they thought was going to be the worst thing they ever had to do turned out to be not so. Can you talk about that a little bit and what your experience has been for your guests?
Sure. We have an incredible nursing staff um, with a variety of experiences. They're here 24/7, as well as our medical director. So not only are they safe here within the facility, but knowing that there's also a variety of people, there's the nursing staff, medical staff, therapists, and also support staff. There's a lot of people here helping them through something that could be very scary. And especially for a lot of people who have been self-isolating for so long. I mean, holding up in your house and all of a sudden you're just kind of thrown into in the world again of having to be around people and dealing with an experience that's not necessarily your happiest point in your life. So what I've seen is it can be very scary, but you have like the medical experts, because that's a big piece of it too, is just making sure, depending on what the substance is that you're coming down or off of, that you're taking care of there, and having therapists here to go in and help walk you through what you should be experiencing, what withdrawal symptoms are like, how will be lessened, and encouraging people to just to work through this really painful time period because it will be better on the other side.
Yeah, and the idea of detox at Gulf Freeze recovery isn't just to get clean, as people use that
Mhm.
term, but
Right.
it's to get your mind clear
Mhm.
so that you can begin the program.
Right.
And right, and you can accept. So when that's done, what happens? You've talked about group and individual. I'm done with what happens when I'm done with the detox. How does my life, my day at Gulf Breeze change?
Sure. So it's almost like a big cloud has been lifted, right? So anytime anyone's been using substances, been in their own little prison, in their own head, to where with all their thoughts, alone with their thoughts, which can be a terrifying place, to where once this cloud has kind of been removed, to where they can think more clearly and be more open and receptive to change. And so it becomes a little less scary because it is a pretty structured schedule. It takes a minute to get used to, but it's almost like going to school, mixed in with some playtime too. So there's classes, there's the interaction with the groups that are very engaging. You're also learning. So the coolest piece, I think, is that self-discovery that comes out of it, because it's not just, oh, there's something wrong with me, versus like, oh yeah, so this happened and that happened, and this is how I coped with it. Oh, okay. So let's see. I'm learning more about me and I'm learning new tools to use so that I can then move forward and make these changes on my own and not feel always like the victim.
Right. That's a really good point. The whole victimization and the fact that at Gulf Breeze Recovery, we refer to our people as a guest.
Yes,
And as a guest, talk about the center. I mean, I hear people talking about the food, I hear people talking about the excursions, the library. Touch on some of those aspects of your stay.
sure. So we do have two chefs that are here, which is pretty amazing. So I was very surprised myself coming through and seeing the quality of the food. That's very healthy option. So you say, well, all the things we have, there's also a nutritionist that works here. And so there are classes specifically on nutrition and learning how to eat better and having a healthier body, how that affects your brain. So the food's wonderful. Um, there's 3 full meals, there's snacks, uh, healthy choices. There's not a lot of sugar. There's a sauna that can be utilized on the weekends. There's a pool. We're on the beach, which is really, really nice. And there's a big, long bridge that's right next to us. So we take a lot of bridge walks. You can do this for individual sessions just to get out of the normal room that you're sitting in. There's also beach walks. There's a lot of recreational type things because as we're working through traumas, we want your body to move and have movement. Same with yoga. There's yoga classes, even people who are a little physically impaired that maybe don't have the same mobility. There's chair yoga. And so there's always a way that everyone is able to participate.
Yeah, very, very nice. And then I don't fish, but so many people talk about the fishing dock. And for
Right.
some folks, they don't fish either, but they sit there and have a moment
Yes,
where, and that
exactly.
moment, what's just, and I'd love to hear your thoughts. That moment, because when you're busy with a substance abuse, you're constantly working on when am I going to get it? Where am I going to get it? How long is it going to last? When is the, and to be able to sit on the dock and enjoy the sunrise or the sunset, that's unique, isn't it, for someone?
It is, and it allows for that connection with nature. So people that maybe slept through sunrises or never left their room to even see a sunset, it's a pretty magical experience. It's to be out there, connect with nature. Sometimes it's a great time to connect with other guests. So maybe you're out there at 5 a.m. every morning, and then so is another guest. And so you're able to share experiences together. So it can be, again, a very engaging experience. It's a way to just take a moment to breathe and to know that you're still here and you still have a lot of life left in you. And so it's been very therapeutic.
Yes, and everything that you're alluding to also touches on the fact that so many people think they can't have fun anymore if they don't have this stimulus.
That's really true. In fact, I just had a client very recently who, in her first week, she was like, I can't believe I'm having fun with people sober. And she was so surprised. And she said it multiple times because couldn't even remember the last time that she had been sober around peers, doing something, whether it be playing games, going to the movies, the dolphin cruise, whatever it might be, bowling, just all these things to where, she felt like she had to be under the influence, but actually it was pretty fun to engage and speak with other people without having to be on a substance.
Yeah, and the other thing I think that you uncloak at Gulf Breeze Recovery is the shame and
Mhm.
the guilt that you live with because we're not very kind about people with mental disorders or substance abuse, and and now these folks can feel normal. Is that fair?
Yes, yes, very much so. And I think some also depending on the substance, there's even that kind of stigma to where people who maybe only consumed alcohol versus some people that struggled with drug abuse. It's a very interesting to see those people figure out, wait a minute, that they even had their own stigmas attached to each other. And to figure out, oh, wait, it's not the substance. It's what's going on in here. And that's really cool to see.
That is so good because so often if it was oxycodone, well, you don't understand
Mhm.
because you were drinking, and you don't understand because you were using drugs intravenously. And the fact is, that's the external.
Mhm.
And what I'd like to talk about a little bit is the approach at Gulf Breeze is to get to the root cause. It's an inside job. So
Mhm.
let's talk about that a little bit more. You have so much more to add to that.
Right. So it really is the inside out approach to where we can't control anything on the outside. We can't control what anyone is going to say, how they're going to react. We can't control if a car is going to cut us off while we're driving. It's simply how we respond to that. And so many people, especially people in addiction, you find yourself so reactionary to where it's a trauma response, to where the window of tolerance has become so narrow to where it doesn't take anything because the rubber band is just wound so tight just to react to everything. But what we really teach here, it's like, no, it's coming from in. It's like we can't control any of that, but we can control how we respond. And so it really gives people kind of back that power. Again, that victimization piece where it's you're not necessarily the victim to everything. You still get to make decisions. You can choose how to react. If it's a thought, just because you think it doesn't mean it's real. So that's a really cool experience to work through with people.
Yeah, let's talk about that a little bit because within the three principles, that whole thought thing is
Mhm.
really a cornerstone to, I mean, what your thoughts are saying aren't necessary, whether you attach to them or not is your choice.
Right. Yeah, because we can't control the thoughts coming in. I can't remember what the number is, but it's like I think we have 100,000 a day or whatever it might be. And so people will also get very judgmental on themselves too, of like, why do I keep having that thought? Well, we can't control the thought. It's what we do with it. How much power am I putting behind it? The thought is there, oh, I wish I could have a drink, or oh, that looks good. Well, that was a thought, and that's okay. It's okay that I had that thought. It's still my choice what I do with it.
Right. Take a breath and just let it ride and see what
Yes,
happens.
right,
Don't make the thought control you. You control the fact that you can let it go.
right. Your response to it, exactly.
That's a big deal. That's hard to do, I
Hmm.
suspect. Or is it not hard to do? Is it?
It it's hard to do, and so what I found, I mean, and I even give my own examples for myself that I have to remind myself all the time because it is a skill. It's learning a new skill, just like riding a bike. So just because we haven't done it up until now, that doesn't mean we can't do it moving forward. But it's really interesting to think about thoughts and talk about thoughts. And so when we talk about activating neural pathways, adaptive neural pathways, if you think about a funny movie or puppies, and so you kind of see how your face changes and how your body kind of changes. Well, that's an activation from a thought. So the same thing happens when you think about something from the past, something hurtful or harmful. It's kind of, you notice your body start tensing up. So it's just kind of showing these real life examples of watch what your body does. Let's identify the feelings associated with, and that all came from here. And then people are just going, "Oh my gosh, how did I not know this?" And it was like, "You do now."
Yeah, yeah. It's like
Mm.
Dorothy. It was there all the time.
Yeah.
Right. Now, talk to the viewer about how we incorporate the family in this process, because this person has lost a lot of trust, and families have been really brutalized sometimes, and so they need to acknowledge that, wow, I'm seeing a change. How does that, how do you incorporate the family in this process?
Sure. So each guest gets two family sessions, and these family sessions can be with a spouse, they can be with a parent, two parents, their children, whomever it might be that they want to loop back in. Usually, therapists will have a conversation with whomever they've given access to, or I can't think of the word right now, The release, yeah, once they've given that release of information, and obviously therapists aren't sharing back and forth the nitty gritties from sessions. It's really just about their experience here and what's next. So that's huge. So I always preface all of my family sessions that this isn't the time to come in and have a true couple session, because the guest is the client here. But what we're doing is we want to bring in the guest. We want to open these lines of communication, which sometimes the guest may not even be on speaking terms with the spouse. So this is their first time coming in. And so it's opening these doors of communication to answer questions about the program. But the biggest part is what's next, because getting through the treatment is just one hurdle. Then it's, what does real life application look like? And honestly, a lot of family members want to know, how can I help? What can I do? How can I provide this support? What triggers or relapses do I need to be aware of? And so this is a great time for there to be the direct interaction between the two, but also have the therapist there. They can help, add some additional information or details about what might be needed.
Yeah, perfect. Because for the family member, they're seeing that their loved one at least has a clear vision. They can tell their mind is clear. They saw how cloudy it was before, and now it's the work comes in. How do I help to support that? And what does happen when I've been through the program, I'm ready to graduate? How does aftercare fit into this whole process?
Okay, so there's a few options. And so we start talking about discharge planning, honestly, almost from the get-go, because that's the biggest piece. What's next? So therapists work with the client on their blueprint for success, which we try to be as detailed as possible, but they get to take this with them. So this is, what are my sober supports? What are the triggers? What do I need financially? Some people may not even know where they're living at the time. So we talk through all these things. Sometimes these things are shared if the guest wants with the family member during that session. So that's one piece of it. We start talking right away about IOP, if intensive outpatient is a step down, if that's something that they would like to do, if they would like to continue having a pretty hefty support system, but without being in residential. So that is an option to sign up into our intensive outpatient program here, which includes 3 group sessions a week and 1 individual session with the therapist each week. And that's 90 days. So that's pretty cool. So you could do it all by Zoom if you need. You do need to be in the state of Florida. But you can participate by Zoom if work schedules don't really allow. And then, or you can be in person. And then you also get a 3P educator. So that's whether you do IOP or not, that's part of the program. And our group of 3P educators range from different backgrounds. Some are therapists, some are in recovery. So there are weekly Zoom sessions during one of the classes each week, to where all the guests get to meet each of them virtually, so that they can see who they have more of a connection with, because they'll get to meet with this person via Zoom for 4 full-hour appointments or 8 30-minute appointments. And that's, again, just providing that additional layer of support once they've graduated and left the facility, which is pretty cool.
Very nice. Yeah, it keeps you reminded of what you were doing well, and keep that process going for yourself.
Yeah.
Um, some of the people that are at Gulf Breeze, some of the staff, including the I don't know what we call the medical director, have been through recovery, are in recovery. You have not. Is that something that you address with your guests? Is that something that guests question you on? How can you possibly understand you haven't been through it?
I have been asked by guests if I'm in recovery, and I explain that I have not. And then I explain, why I chose this place. A lot of times they want to know why I chose to work here. I haven't had anyone question my knowledge or my understanding, I guess, of their situation. I haven't had that happen, but I have had the question before, because I think they're just curious. Because I think that, like I
Yeah,
said, we provide so much psychoeducation here too on, like you said, getting to the root, to where it's not just that substance. It's let's figure out how to give you the tools that you need to move forward in life.
right, right. And it's a no judgment zone. So it's really,
Right.
it's, they're directing what's going to happen, what's going to happen next.
Yeah.
Um, it's just so often I like, even when I was when we do the marketing, some people say, well, I only want to listen to testimonials from people who have suffered from alcohol. And once you get over that hurdle that it's not about the substance, it's about
Mhm.
the root cause. It's the root cause. And so many centers take care of the substance, but never get deeper down, down, down to where, because the weed will come back
Absolutely.
and so important. What do you want to make sure that a person watching you and I, Renee, today learn and know from this podcast? What do you want to make sure they hear you say?
I think one of the biggest pieces is that you're worth it. So many people think I can't leave life and go give up, 2 months, when it flies by. But it's like you're worth it. You're worth the experience to kind of take, this is the time to be selfish, is now. It's come into the facility, regroup, and then be able to come out with a different mindset, because it's well worth it. And especially that self-discovery piece. I just think that's the coolest piece for anybody that I've ever spoken to. Is just when you get to understand you, and then love yourself, and you leave a much different person.
I love that because most people have spent multiple years
Mhm.
on this, creating this other person, this
Mhm.
abusive person, and 2 months to discover who you really are.
Yeah. And that's just
That's
scratching the surface, right? Yep.
right. Anything else you want to make sure that this audience hears from you?
I think it's also really cool. I love seeing the different ages and the different demographics come in. So, you've got, 19, 20-year olds down there in class and eating lunch and going on dolphin cruises with 80-year olds. And so sometimes some of the best friendships and bonds are people that have just been here, or people that have learned from each other, I guess is what I'm trying to say. That a 19-year-old's learning from an 80-year-old, and an 80-year-old's actually learning from the 19-year-old, from their experiences. And that is a really cool thing that I don't really know where else you would get in this safe environment. I said you're all away from home. It's totally out of your comfort zone. But when you kind of break down that wall, and you're just kind of like, that's really interesting. Other people have had experiences too. I think that's what's really cool too about this place.
Yeah, I love that. Well, Renee, that was perfect. Thank you so much for your
Sure.
time today.
You're
I
welcome.
really appreciate it.